Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to today's podcast segment where we explore important themes surrounding addiction, alcohol use, and recovery. Thank you for joining us. Before we begin, it's essential to note that our discussion today is intended for educational and reference purposes only. It is not a substitute for medical, psychological, or professional advice. Many individuals have observed how social gatherings often revolve around alcohol. In some communities, drinking is not just common, it can feel like a social expectation. This raises an interesting question. How do these community norms shape our personal experiences with alcohol? When we talk about heavy drinking in a community, it's crucial to recognize that these patterns can greatly influence individual behaviors and perceptions of risk. However, just because alcohol use is prevalent, it doesn't mean that everyone within that community will develop a substance use disorder. Each person's relationship with alcohol is unique, and the community itself is not solely responsible for individual choices. Many people mistakenly believe that if drinking is widespread, it must be safe or normal. This is a misconception. High levels of alcohol consumption can pose significant risks, regardless of how common the behavior may seem. Additionally, some individuals may think that their discomfort with community drinking is an unusual reaction. In reality, feelings of concern can arise from various factors, including personal history or differing values. It's important to recognize that these feelings are valid and shared by many. Another common misunderstanding is that identifying heavy drinking patterns within a community somehow labels all its members as having issues. This perspective overlooks the vast individual differences in consumption habits and coping strategies. Just because a community has prevalent drinking patterns does not mean all its members are struggling. In practice, when alcohol consumption is a norm in a community, it can shape social expectations and access to alcohol. Individuals may regularly encounter alcohol advertising, events focused on drinking, and social pressures to partake. This environment can, understandably, influence perceptions of what constitutes normal drinking behavior. However, it's important to clarify what this discussion does not imply. Recognizing community drinking patterns does not mean that individuals are incapable of making their own choices regarding alcohol consumption. Personal agency remains a critical factor. Additionally, the internal feelings of concern or worry about these patterns do not equate to an objective assessment of risk. It's an emotional response influenced by one's environment. Lastly, this conversation does not aim to diagnose individuals or communities with substance use disorders. Instead, it highlights how environmental factors can shape perceptions and behaviors related to alcohol. Understanding these dynamics is essential for recovery communities and public health dialogues. By exploring the link between community drinking patterns and individual perceptions, we can foster more informed discussions about behavioral health. For those considering careers in substance use disorder counseling or behavioral health, grasping topics like these can be invaluable. It may help prepare you to approach these issues with a nuanced understanding, enhancing your ability to support individuals on their recovery journeys. As we conclude, remember that discussions about alcohol use and recovery are often addressed in addiction counseling education. Institutions such as InterCoast colleges offer programs that include these vital topics. If you're interested in learning more about educational pathways in this field, consider exploring what they have to offer. Thank you for listening, and take care.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.